Hi, I'm Jamie Crestis. I am the coordinator for the emergency department and the program director for our PGY2 Emergency Medicine Pharmacy residency. PGY2 Emergency Medicine resident has a robust experience, of course, with emergency medicine, but they also partake in trauma required learning experiences. They do a rotation with our Poison Control Center at CHOP. They also are incorporated with our satellite hospital at Geisinger South, functioning as the sole emergency medicine pharmacist there. And they have, of course, an ICU rotation and some elective rotations such as hematology, oncology, pediatrics would be required, but advanced pediatrics is another nice elective opportunity, which is located at our GMC campus in Danville. But all other locations are offered here at our GWV site. And the poison control toxicology rotation is a virtual rotation, which is wonderful because that rotation for all residents within Pennsylvania is a virtual option. So our residents aren't having a different experience than Philadelphia residents. They have the same experience and the same wonderful educational opportunities. Our emergency department services in general, as far as our pharmacists go, we offer 24/7 coverage with an emergency medicine pharmacist. We are a level 1 trauma center certified stroke heart attack center. And so our pharmacists are intimately involved with acute situations at the bedside. And it's a wonderful collaborative approach where our providers or nurses really look to that emergency medicine pharmacist as an important and necessary piece for acute bedside patient care. Geisinger is incredible as far as pharmacists and in the acute care setting and in all our settings in the sense that we offer robust collaborative practice agreements. So our pharmacists truly are practicing at the top of their license and having direct impact on patient care and quality outcomes.